to start with something that the Prime Minister warned Australians about yesterday, the very idea of holding so-called Omicron parties, because it is possible to be reinfected with this specific variant. Does it mean that people who experience Omicron do not acquire natural immunity to coronavirus?
Well, we still don't know. We know Omicron itself is associated with higher rates of reinfection. Initially, that was obviously people that had had Delta or other viruses previously. So it's a bit too early to really have a strong handle on whether that's true for Omicron itself being able to establish another infection. But at the moment, we've got more than one variant circulating. So it's still absolutely true, even if Omicron doesn't reinfect after an infection has cleared. At the same time, you could have a Delta infection at a party, and then you're still vulnerable to Omicron anyway. So, yeah, it's still possible to have reinfections. That's how we discovered Omicron. It was doing that in South Africa that had only just cleared its major wave with Delta, and they were seeing a lot of cases in people that had had a Delta infection.
Can people expect that if they do experience infection with one or another variant of coronavirus, that they will have at least a few weeks or a month before becoming susceptible to catching another?
Yeah, that's probably what you might expect to see. We know it stimulates the whole immune system, not just the antibodies that they normally measure, but also our T cells, and that can protect you. It certainly will protect you from more serious illness. It might not stop infection completely. So they do encourage people when they're waiting to have their next vaccination, for example, or their booster dose, wait till the infection's cleared, give it a bit of time, make sure you're recovered, but at the same time do get that next dose, because that combined with a history of infection actually gives you an even better protection, probably from a broader range of variants.
And so how long should you leave it before you actually get your booster if you haven't had it and you've been infected with COVID?
Well, really, it's as soon as you're completely well and it's cleared. There's no reason why you shouldn't have it. You do want to make sure that you're well over the infection, though. You don't want to have an already primed immune system when you're having your booster, because it just might mean you have a local reaction that's a bit more obvious, a bit more annoying. So leave it for a while. They do allow, under the vaccination rules, up to 6 months before people then have the next shot. But of course, we're in a very different environment at the moment with the amount of Omicron circulating. So I'd say, again, if you're not sure and you've been quite unwell, obviously you'll be talking to your doctor. But at the same time, once your infection's cleared, if you had very mild symptoms or no symptoms, then, you're basically ready to have your booster whenever you can book yourself in.
What is known about the risk of the Omicron variant for vulnerable people who've indeed had their booster, or for those people who've actually had 4 shots? Because there are many vulnerable people in the community whose primary course was considered 3 shots, and now they're having their actual booster, making it 4. Do they need to continue to be wary about moving about the community right now?
Well, the sad thing is, with the amount of virus that's out there in some of our capitals, but now it's more and more of our states being impacted, that there is that greater likelihood that you will be exposed to someone with the virus when you're out and about. But all those things that people know about keeping them safe, and our immunocompromised community or very vulnerable people are very much aware of those, will still help protect you. So you're right, you might need 3 doses to try and boost that initial primary course cover, but really important that anyone who's vulnerable to infection and more serious illness is, if they're ready, if they're due, to get that booster dose, because it will make a difference. We heard from the Chief Medical Officer yesterday that it's actually true that Omicron now is consistently being described as causing less severe illness in most. We still are seeing some people who get very unwell, and the booster will help reduce that risk. So the booster is a really critical thing, as well as managing your exposure if you're out and about, doing those safe things, masks, getting a good mask if you're someone who's immunocompromised, and learning how to use it well will just give you that bit of extra protection.
Now, there is a lot of audience interest in this next topic. Governments are now exempting some close contacts of positive cases on the basis that they are asymptomatic and recording daily negative RAT results. Is there still a risk that these people could be positive and transmit the infection to others in the workplace?
Well, it's actually true that a lot of these people will only find out that their household contact is a case after they themselves might have already been infected from that person and at work while infectious. If they're asymptomatic, they'd have no way of knowing. And we know a lot of people are still waiting until they get symptoms a few days after that to get tested. So it does, in fact, increase the risk that someone has passed it on to a household member who's taking it into work. And it's only when they get their test result back that the close contacts are identified and asked to stay home. If they are still testing negative, particularly in a series of tests, then it probably is incredibly low risk that that person is then going to add to the risk in the workplace. But it's not zero in the first place. It's not just household contacts of cases who might unknowingly be at work with the virus. It's also other people that might have picked it up at the pub or hanging out with friends over dinner. So we have such a tight definition of close contacts now that we have to recognise that we are living with transmission risk in the community. We're just trying to keep it suppressed, and so making sure people who are known contacts going to work whilst testing positive, that's what you're doing to reduce risk. But allowing people back into the workplace with a whole lot of mitigation measures in place. And it's also important to note these people aren't out of quarantine. They're only out of quarantine to go to work. So they're not going out to restaurants and doing other things in the evenings. They've probably got less ongoing exposure during that period where they're being monitored than other people in the workplace who are still able to go out and about and might yet acquire the infection and take it to work. So we're just trying to reduce the risk. The risk isn't zero to start. It might be a marginal increase in risk, but very small in the scheme of things.
Well, let's finish on something you just touched on, socialisation. Is there still a risk of contracting COVID if you socialise with people who've been ill with coronavirus but have now left isolation after day 7, as the rules say you can if you are no longer experiencing symptoms?
Yeah, so most people will go into isolation not on day 1 of their infection, not even day 1 of their symptoms. Often it's when they've had that result come back. And if they had that via PCR test, it could be 10 days after they were initially infected, then got symptoms, got tested, and of course we've had a lag in the results. So in fact, that second week, and people are advised to wear masks and keep doing things a bit safely in that second week, they're actually probably getting close to their 3rd week of infection. So the chances of them having the virus, particularly if their symptoms have cleared well and truly before they finish that known week where they were quarantining or isolating, their risk to others would be very low. So asymptomatic people might pass it on. They are asked to be a bit more careful during that period, but the risk is very low.
And so has the time frame that we are thinking about in terms of the potential for infection changed because of the Omicron variant? Because for some time now we had been told that we would need to be at home for 14 days and that the risk of actually becoming symptomatic could happen within a fortnight.
Yeah, there are two things here. One is the 14-day incubation period was quite conservative. We wanted to make sure that no one had a really long incubation period and then might show signs of infection only very late in the second week. So that was put in there for that reason. And the earlier variants had longer incubation periods. You know, they've shortened from 5 to 6 days down to about 5 days to 4 in the Delta and possibly 3 to 4 with Omicron. So that process has spread up. People are going to get infection. Often we see it sooner, and many of them are having shorter infections, particularly with our high vaccination rate. So it has reduced, but also the data from New South Wales showed that 75% or something like that of people who were going to be positive were positive in those first 5 or 7 days. And so, you actually trying to get that balance between not discouraging people from testing and us discovering they're potentially infectious, and because you're putting such a burden on people to quarantine for a long time and all their contacts, it's bringing that back in. So we find people in that period where they're most likely to be, if they're a case, very infectious, and ask them not to isolate and their household contacts. So that's the plan. It's really putting the effort into the highest yield areas, both from the health department's point of view in the rules they set, but also what we're asking people to do. So step out of life for those periods where you're at most risk, and then just be cautious after that.
Okay, Professor Catherine Bennett, it's just terrific that you can take the time to talk to us about the key questions that many are grappling with right now. Thank you.
Thank you.